Question 1. A clinical medical assistant is preparing a patient for an EKG. The patient expresses concern about the procedure. What is the most appropriate response for the medical assistant? A. It's just a quick test, don't worry about it. B. The doctor will explain everything to you. C. I understand you're feeling anxious. An EKG is a painless test that records your heart's electrical activity. D. If you're too nervous, we can reschedule. Answer: C. I understand you're feeling anxious. An EKG is a painless test that records your heart's electrical activity. This question tests your ability to communicate effectively and show empathy while providing patient education. The keyword most appropriate response indicates you should choose the option that combines empathy with professional information. Acknowledging the patient's feelings first, I understand you're feeling anxious, and then providing a clear, simple explanation of the procedure helps alleviate fear and builds trust. For example, telling a patient that the test is painless and what it measures can significantly reduce their anxiety. Always remember to validate a patient's feelings before offering factual information to help them feel heard and understood. Question 2. Which of the following is the most effective method to prevent the spread of infection in a healthcare setting? A. Wearing gloves at all times. B. Routinely cleaning surfaces with disinfectant. C. Practicing proper hand hygiene. D. Isolating all patients with known infections. Answer: C. Practicing proper hand hygiene. This question focuses on the fundamental concept of infection control. The keyword most effective method directs you to the single best practice for preventing disease transmission. Proper hand hygiene, which includes hand washing with soap and water or using alcohol-based hand rub, is universally recognized as the single most critical measure to reduce the risk of spreading microorganisms. Even with gloves and surface cleaning, contaminated hands can still transmit pathogens. For instance, if you touch a contaminated surface then touch your face, hand hygiene breaks that chain of infection. Always remember that clean hands are your most powerful tool in preventing infection. Question 3. A medical assistant is taking a patient's blood pressure and notices the cuff is too small. What effect will this likely have on the reading? A. The reading will be artificially low. B. The reading will be artificially high. C. The reading will be accurate, but uncomfortable. D. The reading will fluctuate unpredictably. Answer: B. The reading will be artificially high. This question assesses your knowledge of accurate vital sign measurement, specifically blood pressure. The keyword cuff is too small is the crucial clue to understanding its impact. When a blood pressure cuff is too small for a patient's arm, it requires more pressure to compress the artery, resulting in a reading that is inaccurately elevated or artificially high. For example, using a pediatric cuff on an adult will give a much higher reading than the patient's actual blood pressure. Always ensure the blood pressure cuff size is appropriate for the patient's arm circumference to obtain an accurate measurement. Question 4. When obtaining a patient's medical history, which of the following is an example of an open-ended question? A. Do you have any allergies? B. Are you experiencing pain today? C. Can you tell me more about what brought you in today? D. Have you taken any medication for your symptoms? Answer: C. Can you tell me more about what brought you in today? This question tests your understanding of effective patient communication techniques for gathering comprehensive information. The concept is about using open-ended questions, which encourage patients to provide detailed responses rather than simple yes or no answers. The keyword open-ended means the question cannot be answered with a single word. Asking, "Can you tell me more about what brought you in today?" allows the patient to elaborate on their symptoms, concerns, and history in their own words, providing richer data for the medical record. For instance, if a patient says, "My stomach hurts," an open-ended question would be, "What does the pain feel like?" instead of, "Does your stomach hurt a lot?" Remember that open-ended questions are essential for obtaining a thorough and personalized patient history. Question 5. A medical assistant is preparing to administer an intramuscular, IM, injection. Which of the following needle gauges is most appropriate for an adult IM injection? A. 25 gauge. B. 22 gauge. C. 18 gauge. D. 27 gauge. Answer, B. 22 gauge. This question relates to the practical skill of medication administration, specifically needle selection for injections. The concept being tested is knowing the appropriate needle gauge for an intramuscular injection in an adult. A 22 gauge needle is generally considered appropriate for adult intramuscular injections, as it is wide enough to allow viscous medications to flow but fine enough to minimize patient discomfort. Remember, a smaller gauge number indicates a larger needle diameter, so a 22 gauge is larger than a 25 gauge but smaller than an 18 gauge. For example, if you were giving a flu shot, which is IM, a 22 gauge needle is a common choice. Always select the correct needle gauge and length based on the patient's size, medication viscosity, and injection site to ensure safe and effective delivery. Question 6. According to HIPAA, which of the following is a permissible disclosure of protected health information, PHI, without patient authorization? A. Sharing patient information with a pharmaceutical representative. B. Disclosing patient information for public health activities. C. Posting patient updates on social media for family members. D. Providing patient information to a lawyer for a personal injury case without a subpoena. Answer, B. Disclosing patient information for public health activities. This question tests your knowledge of HIPAA, Health Insurance Portability and Accountability Act, regulations, specifically regarding permissible disclosures of protected health information, PHI. The concept is understanding when PHI can be shared without explicit patient consent. HIPAA allows for disclosure of PHI without authorization for specific purposes, such as public health activities, treatment, payment, and healthcare operations, to protect the well-being of the community. For example, reporting a contagious disease like measles to the local health department is a public health activity allowed by HIPAA. Always remember that patient privacy is paramount, but specific regulations exist for the public good. Question 7. A medical assistant is performing a venipuncture and notices the patient's arm starting to swell around the venipuncture site. What is the immediate next step the medical assistant should take? A. Apply a tourniquet above the swelling. B. Withdraw the needle. C. Continue the draw, but apply pressure. D. Ask the patient to clench their fist tighter. Answer, B. Withdraw the needle. This question addresses a critical safety protocol during phlebotomy procedures. The concept is recognizing and responding appropriately to complications during venipuncture. The keyword, swelling around the venipuncture site, indicates a potential hematoma or infiltration, which requires immediate action to prevent further injury. The immediate next step is always to withdraw the needle, apply direct pressure, and elevate the limb to minimize swelling and bleeding. For instance, if you see swelling, it means blood is leaking out of the vein, and continuing the draw would only make it worse. Always prioritize patient safety by promptly stopping the procedure if a complication arises. Question 8. What is the primary purpose of a superbill in a medical office? A. To serve as a patient's appointment reminder. B. To provide a detailed list of services rendered and charges for insurance submission. C. To document the patient's medical history. D. To track inventory of medical supplies. Answer: B. To provide a detailed list of services rendered and charges for insurance submission. This question assesses your understanding of administrative tasks in a medical office, specifically related to billing and coding. The concept is understanding the function of a superbill, also known as an encounter form. The primary purpose of a superbill is to list the services provided to a patient during an encounter, including diagnosis codes, ICD-10, and procedure codes, CPT, along with charges, which then facilitates accurate claims submission to insurance companies. For example, after a doctor's visit, the superbill summarizes everything from the office visit code to any tests performed, allowing the patient or staff to submit it for reimbursement. Always remember that the superbill is a crucial document for financial and insurance processing. Question 9. When measuring an infant's head circumference, where should the measuring tape be placed? A. Just above the eyebrows and around the occipital prominence. B. Across the top of the head and under the chin. C. From ear to ear, across the forehead. D. Around the neck, just below the jawline. Answer: A. Just above the eyebrows and around the occipital prominence. This question tests your knowledge of pediatric measurements, a common clinical task for medical assistants. The concept is correctly measuring an infant's head circumference, which is important for monitoring growth and development. The measuring tape should be placed just above the eyebrows, over the most prominent part of the forehead, and then wrapped around the largest part of the head, typically over the occipital prominence, the back of the skull. This ensures you get the largest and most accurate reading. For example, if you measure too low on the forehead, the reading will be artificially small. Always ensure accurate placement to obtain reliable growth data for infants. Question 10. A patient calls the clinic reporting symptoms of chest pain, shortness of breath, and left arm numbness. What is the medical assistant's most appropriate action? A. Advise the patient to take an antacid and call back if symptoms worsen. B. Schedule an appointment for the next available slot. C. Instruct the patient to call emergency services, 911, immediately. D. Tell the patient to come to the clinic right away. Answer: C. Instruct the patient to call emergency services, 911, immediately. This question tests your ability to recognize and respond to medical emergencies, a critical aspect of a medical assistant's role. The keywords chest pain, shortness of breath, and left arm numbness are classic signs and symptoms of a myocardial infarction, heart attack, which is a life-threatening emergency. In such situations, the most appropriate and safest action is to instruct the patient to call emergency services, 911, immediately, as they require rapid medical attention and transport to a hospital. For example, advising them to come to the clinic or wait for an appointment delays critical care that only paramedics can provide. Always prioritize patient safety and direct them to the fastest appropriate level of care during potential emergencies. Question 11. Which of the following is the proper technique for performing a capillary puncture on an adult? A. Puncture the center of the fingertip. B. Puncture the side of the ring finger. C. Puncture the thumb. D. Puncture the fleshy part of the palm. Answer: B. Puncture the side of the ring finger. This question assesses your practical knowledge of capillary blood collection. The concept is identifying the correct site for a capillary puncture in an adult. For adults, the most appropriate site for a capillary puncture is the fleshy pad of the middle or ring finger, slightly off-center, on the side, of the fingertip. This area has a good blood supply and is less sensitive than the very center, while avoiding bone or nerve damage. For example, puncturing the center or tip could cause more pain and potentially hit bone, while the thumb is often calloused. Always aim for the sides of the middle or ring finger to ensure a safe and effective capillary blood collection. Question 12. Before beginning any clinical procedure, a medical assistant should always verify the patient's identity using at least how many identifiers? A. 1. B. 2. C. 3. D. 4. Answer B. 2. This question emphasizes a fundamental patient safety protocol in healthcare. The concept is correctly identifying the patient to prevent errors. The widely accepted standard, often mandated by regulatory bodies, is to use at least 2 patient identifiers before any procedure, medication administration, or specimen collection. Common identifiers include the patient's full name, date of birth, and sometimes a medical record number. For example, asking, "Can you please state your full name and date of birth?" helps ensure you have the correct person. Always remember that 2 identifiers are the minimum requirement to ensure patient safety and prevent medical errors. Question 13. A medical assistant is preparing to clean a wound. Which type of solution is typically used for routine wound irrigation? A. Hydrogen peroxide. B. Isopropyl alcohol. C. Sterile normal saline. D. Povidone iodine. Answer C. Sterile normal saline. This question tests your knowledge of wound care principles and appropriate medical supplies. The concept is understanding which solution is safe and effective for cleaning open wounds. Sterile normal saline, 0.9% sodium chloride, is the most commonly recommended solution for routine wound irrigation because it is isotonic, meaning it does not harm living cells and effectively removes debris without causing irritation or damage to the wound bed. Hydrogen peroxide and povidone iodine can be cytotoxic to healthy tissue, while isopropyl alcohol is too harsh. For instance, if you clean a cut, saline gently washes away dirt without stinging. Always use sterile normal saline for general wound cleansing unless otherwise specified by a physician. Question 14. Which document is used to record a patient's subjective symptoms, objective findings, assessment, and plan for treatment? A. Laboratory requisition form. B. Consent form. C. Soap note. D. Patient registration form. Answer C. Soap note. This question refers to the critical administrative task of medical documentation. The concept is understanding the structure and purpose of a soap note. A soap note is a widely used method for documenting patient encounters, organizing information into 4 distinct sections. Subjective, patient's reported symptoms; objective, measurable observations by the clinician; assessment, diagnosis; and plan, treatment course. This structured format ensures comprehensive and organized patient records. For example, if a patient reports back pain, subjective, the MA might note tenderness on palpation; objective, the doctor diagnoses a muscle strain; assessment, and prescribes medication and rest; plan. Always use the SOAP format for clear and concise medical documentation. Question 15. What is the normal range for an adult's resting pulse rate? A. 40 to 60 beats per minute, BPM. B. 60 to 100 beats per minute, BPM. C. 100 to 120 beats per minute, BPM. D. 120 to 140 beats per minute, BPM. Answer B. 60 to 100 beats per minute, BPM. This question assesses your fundamental knowledge of vital signs. The concept is knowing the normal physiological ranges for an adult's resting pulse rate. The normal range for an adult's resting pulse rate is generally considered to be 60 to 100 beats per minute. Readings outside this range, especially persistently high, tachycardia, or low, bradycardia, rates, may indicate underlying health issues. For example, if you measure a patient's pulse at 72 bpm, you know it falls within the healthy range. Always remember these standard ranges to accurately assess a patient's basic health status. Question 16. A medical assistant observes a coworker taking a photograph of a patient's unusual rash to post on a social media site, without the patient's consent. This action violates which of the following? A. Good Samaritan Act. B. Controlled Substances Act. C. HIPAA. D. CLIA. Answer, C. HIPAA. This question tests your understanding of legal and ethical responsibilities in healthcare, specifically regarding patient privacy. The concept is identifying violations of patient confidentiality. Taking a photograph of a patient without their consent and posting it on social media directly violates HIPAA, Health Insurance Portability and Accountability Act, which protects the privacy of protected health information, PHI. This act is a serious breach of confidentiality and trust. For example, even if the patient's face isn't visible, any identifying information or unique medical condition is considered PHI. Always remember that patient information, including visual data, is confidential and should never be shared without explicit, informed consent. Question 17. What is the primary reason for placing electrodes on specific anatomical locations during an EKG? A. To ensure patient comfort. B. To reduce electrical interference. C. To accurately record the heart's electrical activity from different angles. D. To prevent skin irritation. Answer, C. To accurately record the heart's electrical activity from different angles. This question focuses on the clinical task of performing an EKG, electrocardiogram. The concept is understanding the physiological basis for precise electrode placement. Electrodes are placed at specific anatomical locations to create a picture of the heart's electrical activity from various angles, providing a comprehensive view of its function. Each lead, combination of electrodes, provides unique information about different parts of the heart. For example, placing V1 and V2 on the fourth intercostal space helps visualize the septum and anterior wall of the heart. Always ensure correct lead placement to obtain a diagnostically accurate EKG tracing. Question 18. Before discarding a used needle, it should be placed into which of the following? A. A regular trash can. B. A biohazard bag. C. A puncture-resistant sharps container. D. A labeled plastic container. Answer, C. A puncture-resistant sharps container. This question addresses a crucial aspect of safety and infection control in a healthcare setting. The concept is the safe disposal of sharps. Used needles must be immediately placed into a designated puncture-resistant sharps container to prevent needle stick injuries and the potential transmission of bloodborne pathogens. This is a critical safety measure for healthcare workers and waste handlers. For example, if you finish giving an injection, the needle should go straight into the red sharps container, never bent or recapped. Always remember that safety with sharps is non-negotiable and protects everyone in the clinical environment. Question 19. A medical assistant is scheduling an appointment for a patient who needs a fasting blood test. Which instruction is most appropriate to give the patient? A. You can eat a light breakfast before the test. B. Avoid all food and drink, except water, for 8 to 12 hours before the test. C. You can have coffee and juice, but no solid food. D. You only need to fast for 2 hours before the test. Answer B. Avoid all food and drink, except water, for 8 to 12 hours before the test. This question tests your ability to provide clear and accurate patient education regarding diagnostic procedures. The concept is proper patient preparation for a fasting blood test. For most fasting blood tests, such as a fasting glucose or lipid panel, patients are typically required to abstain from all food and drink, except plain water, for 8 to 12 hours prior to the test. This ensures the test results accurately reflect their baseline metabolic status. For example, if a patient eats breakfast, their blood glucose levels will be elevated, leading to an inaccurate result. Always provide specific and clear fasting instructions to ensure the validity of laboratory test results. Question 20. What is the primary role of the medical assistant during a minor surgical procedure, such as a laceration repair? A. To perform the surgery. B. To administer anesthesia. C. To assist the physician, maintain the sterile field, and provide patient support. D. To diagnose the patient's condition. Answer C. To assist the physician, maintain the sterile field, and provide patient support. This question focuses on the scope of practice and responsibilities of a medical assistant during clinical procedures. The concept is understanding the supportive role of the MA in minor surgical procedures. During a minor surgical procedure, the medical assistant's primary role is to prepare the patient, set up and maintain the sterile field, hand instruments to the physician, monitor the patient, and provide emotional support. MAs do not perform surgery, administer anesthesia, or diagnose conditions. For example, you might hand the doctor sterile forceps or sutures while ensuring the patient remains calm. Always remember that your role is to competently assist the physician and ensure a safe and supportive environment for the patient. Question 21. Which of the following terms refers to the complete destruction of all microorganisms, including spores, on inanimate objects? A. Sanitization. B. Disinfection. C. Sterilization. D. Antisepsis. Answer C. Sterilization. This question delves into a fundamental concept of infection control regarding the processing of medical instruments. The concept is distinguishing between different levels of microbial control. Sterilization is the process that completely destroys all forms of microbial life, including highly resistant bacterial spores, on inanimate objects. Sanitization reduces microbial load, disinfection kills most pathogens but not necessarily spores, and antisepsis refers to reducing microbes on living tissue. For example, surgical instruments must be sterilized in an autoclave to ensure they are completely free of all microorganisms before use. Always remember that sterilization provides the highest level of microbial destruction. Question 22. A medical assistant is performing a urinalysis using a reagent strip. Which of the following is an abnormal finding? A. Clear, yellow urine. B. pH 6.0. C. Presence of glucose. D. Specific gravity 1.015. Answer C. Presence of glucose. This question tests your knowledge of common laboratory tests, specifically urinalysis, and what constitutes an abnormal finding. The concept is interpreting results from a urine reagent strip. While clear, yellow urine, a pH of 6.0, and a specific gravity of 1.015 are generally within normal limits for urine, the presence of glucose, glycosuria, is an abnormal finding. Glucose in the urine can indicate conditions like uncontrolled diabetes mellitus and requires further investigation. For example, if a patient's strip shows glucose, it's a red flag that their blood sugar might be too high. Always recognize that glucose in the urine is not normal and warrants follow-up. Question 23. What is the purpose of documenting a chief complaint during a patient intake? A. To list all medications the patient is currently taking. B. To record the primary reason the patient is seeking medical attention. C. To document the patient's family medical history. D. To summarize the physician's diagnosis. Answer B. To record the primary reason the patient is seeking medical attention. This question focuses on the administrative and clinical task of patient intake and documentation. The concept is understanding the definition and importance of a chief complaint. The chief complaint is a concise statement, usually in the patient's own words, describing the main reason they are seeking medical care at that particular visit. It guides the physician's examination and helps prioritize patient care. For example, if a patient says, "I have had a cough for 2 days," that is their chief complaint. Always remember that the chief complaint sets the stage for the entire patient encounter. Question 24. A medical assistant needs to use an AED, automated external defibrillator. What is the first step in using an AED? A. Deliver a shock. B. Attach the electrode pads to the patient's chest. C. Turn on the AED. D. Perform CPR for 2 minutes. Answer C. Turn on the AED. This question tests your knowledge of emergency procedures, specifically the proper use of an AED. The concept is knowing the sequence of steps for operating an AED. The very first step when using an AED is to turn on the device, as it will then provide clear, spoken instructions for the subsequent steps, guiding the user through the process. Skipping this step would prevent the device from analyzing the heart rhythm or delivering a shock. For instance, you can't attach pads or deliver a shock if the device isn't powered on to guide you. Always remember to turn on the AED immediately to activate its life-saving instructions. Question 25. Which of the following actions demonstrates a medical assistant acting within their scope of practice? A. Diagnosing a patient's condition based on symptoms. B. Prescribing medication for a patient. C. Administering a vaccine as ordered by a physician. D. Interpreting laboratory results to a patient. Answer C. Administering a vaccine as ordered by a physician. This question addresses the crucial concept of a medical assistant's scope of practice, which defines the tasks they are legally permitted to perform. Administering a vaccine as ordered by a physician is a common and appropriate clinical task for a medical assistant, as it falls under direct supervision and established protocols. Diagnosing, prescribing, and interpreting lab results for patients are all outside the scope of practice for a medical assistant and are responsibilities of the licensed provider. For example, if the doctor orders a flu shot, you can prepare and give it, but you cannot tell the patient why they need it based on your own assessment. Always ensure your actions strictly adhere to your defined scope of practice to maintain patient safety and legal compliance.